On this episode, we'll talk about if sciatica symptoms get better after weight loss. We'll also talk about who's a candidate for weight loss surgery in 2025, and are there any medical conditions that rule you out? Hello everyone, I'm Dr. Alvarez with Endobariatric.com. Welcome to episode 257 of the Ask Dr. A show. Thanks so much for joining us. And if you are new to our show, I want to welcome you and also welcome you to send me some questions. If you're interested in knowing more about weight loss surgery, gastric sleeve content, you're invited to send me some questions. There's one way to do so, and that is do add the hashtag AskDrA. Otherwise, we can't get to those questions. Also, invite you to subscribe to the channel. That way, you don't miss out on our content. All right, let's get into the show. Okay, so the first question is, I want to know if my sciatica symptoms will get better after weight loss. The answer is yes. They usually do get better because there will be, as you lose weight, there will be less compression on your spine and therefore alleviating sciatica symptoms. So usually the vast majority of the patients do get better. Of course, it will vary from patient to patient or your specific cause of having sciatica condition or sciatica symptoms. Second question is, who's a candidate for weight loss surgery in 2025? All right, because it is not until 2022 that we have new guidelines, because it had been 30 years of us as bariatric surgeons having the same guidelines for 30 years. And in, I believe it was October of 2022, the ASMBS and the International Federation got together with new guidelines. That, by the way, if you got time, you're interested in this, I'll link that file down below. But we keep the same characteristic, the same guidelines for the usual patients, which is a BMI of 40 or more, or a 35 or higher BMI with certain medical conditions like sleep apnea or high blood pressure, or diabetes, or cholesterol, so on and so forth. And they added, I'm giving you a general ballpark figure here. They added another category with a BMI of 30 to 34.9 with metabolic syndrome. That's new. Also they're more open, they're more broad toward having surgery on selected children and adolescents, which is great news for these particular patients or age group that have been suffering from obesity. And the third question is, are there any medical conditions that can rule you out from having weight loss surgery? And the answer is, of course. Of course, there are some conditions. You need to be in an acceptable risk of having surgery, and that is acceptable risk of anesthesia risk. Of course, the anesthesia has their own category. But I'll give you some examples. Severe heart conditions may rule you out. Severe lung conditions may rule you out. Having cancer, having active treatments for cancer will rule you out. And of course, some other, depending on your case, some other gastrointestinal conditions may rule you out. So if you want to know more specifically about your situation, go ahead and contact us, and I'll be more than happy to tell you in your particular case. All right, so there you have it. That is it for episode 257. Did you like it? Leave me one of these, greatly appreciate it. And don't forget to smash that subscribe button down there so we can hang out again. All right, so I'm Dr. Alvarez with Endobariatric.com, where we are changing lives. Yes, we are. One sleeve at a time. Take care and God bless.